So basically, nucleophosmin-1, NPM1, is mutated in around 1/3 of patients with acute myeloid leukemia. It's one of the most frequently mutated genes in that setting, and NPM1 mutation was proposed to carry a better prognosis, particularly in the setting of a normal karyotype and the absence of FLT3 internal tandem duplication. However, patients with NPM1 still relapse, and treatment is challenging for older patients with newly diagnosed AML with NPM1 mutation, as well as for patients who relapse after first-line therapy. In prior studies, particularly from the German group, retinoic acid was proposed to increase the survival of chemotherapy-treated NPM1 mutated AML. And we have reported a few years ago that ex vivo retinoic acid triggers degradation of the mutated NPM1, which we call NPM1C, C for cytoplasmic, resulting in P53 activation and growth arrest. In a recent study published in Hematologica this year, we demonstrate that PML, which is the organizers of nuclear bodies that are domain that control senescence or proteolysis. We have shown that PML is required to initiate retinoic acid-driven degradation of NPM1C, NPM1 mutated AML, as compared to NPM1 wild-type AML, and this enhancement or increase in PML basal expression is mediated by inhibition of Pin1, which is an important isomerase that we have shown that Pin1 is activated in NPM1 mutated AML. So actually, in NPM1 mutated AML, Pin1 is activated, and therefore there is suppression of PML and P53. With retinoic acid, we inhibit Pin1, and this will increase the expression of PML, driving activation of P53. And this activation of P53 will favor the response of the blast to chemotherapy or to arsenic trioxide. And so this retinoic acid PML P53, this Pin1 PML P53 cascade could mechanistically explain retinoic acid facilitated chemotherapy response in NPM1C AML patients, so explaining the biochemical basis of response.